You can run a 10K, feel completely fine, have zero symptoms, and still have a 90% blockage growing inside your heart right now. How is that possible? Because your body is so good at adapting that it can hide a near-complete blockage and keep blood flowing perfectly, right up until the second it stops. This is why, for half of all men, the very first symptom of heart disease isn't chest pain, it's sudden death. In this video, I'm going to show you exactly why that happens, how your body hides these ticking time bombs, why even fit people aren't immune, and what you can actually do to check your heart before it's too late. To understand why a healthy heart fails, we need to look at what's keeping it alive. The heart is a muscle, and like any muscle, it needs a constant supply of oxygen. It gets that oxygen through a network of vessels wrapped around it called the coronary arteries. Early anatomists noticed these vessels form a crown-like shape around the heart. That's where coronary comes from. But I want you to think of them differently. Think of them as the root system of a tree. If one small root gets cut, you lose a branch. If the main trunk gets cut, the whole tree falls. We have two main coronary arteries, the right and the left. The left branches into a critical vessel called the left anterior descending artery, the LAD. In emergency medicine, we have a name for the LAD, the Widowmaker. The reason is pure geometry. The LAD supplies blood to the front wall of the left ventricle, the heart's primary pumping chamber. Block a small vessel, and you lose a small patch of muscle. Block the LAD, and the heart loses its ability to pump blood to the rest of the body. That's not a slow decline. That's a sudden stop. Here's where it gets counterintuitive, because blockages don't just happen to people who eat poorly or never exercise. A healthy artery is flexible, like a brand new rubber hose. Its inner lining, called the tunica intima, is smooth as Teflon. Blood flows past it effortlessly, but over decades, things wear on that lining. High blood pressure, high blood sugar, smoking. Even the mechanical stress of high-volume blood flow during years of intense exercise can cause microscopic scratches on that inner wall. When that happens, your body tries to repair it. It sends LDL cholesterol to the site, like spackle filling a crack. Then the immune system sends white blood cells to inspect the repair. Those cells absorb the cholesterol, transform into what we call foam cells, and eventually harden. That hardened mixture of cholesterol, calcium, and cellular debris is plaque. And the condition is called atherosclerosis. So yes, decades of intense exercise can contribute to plaque formation. Not because exercise is bad for you, but because the body's repair process has a side effect that builds up over time. Most people imagine plaque buildup like a clog in a drain. The pipe slowly narrows until one day the water stops flowing. They assume they'd feel it happening. Shortness of breath, chest tightness, some kind of warning. That's a logical assumption, but it's biologically wrong. Here's what actually happens. As plaque grows inside the artery wall, the wall itself stretches outward to accommodate it, preserving the inner opening for blood flow. This is called positive remodeling. It means you can have a massive buildup of plaque while the tube itself remains 100% open. Normal blood flow, zero symptoms. You can run a 10K and feel fantastic because the blood is still getting through. This is why the first symptom of heart disease is sudden death in 50% of men and 64% of women. They feel completely fine until the very second they don't. So what turns a silent plaque into a fatal event? It comes down to one word: stability. Think of a plaque deposit like a blister, a pocket of inflammatory material covered by a thin layer of tissue. If that thin covering tears, triggered by a sudden spike in blood pressure or intense physical exertion, the contents spill into the bloodstream. This is a plaque rupture. The body reacts as if it's a massive open wound. It immediately sends platelets to clot the blood. In seconds, that clot grows large enough to completely seal the artery. It's not the slow buildup of plaque that cuts off blood flow. It's the sudden, rapid formation of that clot, acting like a cork in a bottle. Blood flow hits a wall. That's a type 1 myocardial infarction, a heart attack. There's a second scenario that's especially relevant for endurance athletes, and it's far less talked about. Meet Robert. He's 50, a disciplined runner with normal cholesterol. During a race, he doesn't feel crushing chest pain. He just feels off. His energy drops. He feels lightheaded and slightly nauseous. He assumes he's dehydrated. At the hospital, doctors find troponin in his blood. Think of troponin like the liquid inside a glow stick. As long as the casing is intact, the liquid stays inside. Snap the stick and it leaks out. Heart muscle cells are full of troponin. When those cells die, they break open and release it into the bloodstream. Robert is having a heart attack. But when doctors look at his arteries, they don't find a 100% blockage. They find one that's 50% blocked. So how did this happen with blood still flowing? It's a supply and demand problem. At rest, a 50% blockage is manageable. The hose is crimped, but enough water gets through. But when Robert's heart rate hits 170 beats per minute, his heart demands a fire hose's worth of blood. The crimped artery can only deliver a garden hose worth. Demand exceeds supply. The heart muscle starts to suffocate. This is called ischemia, and it's a type 2 myocardial infarction. Here's a number worth remembering: 70%. That's roughly the point at which an arterial blockage starts producing noticeable symptoms. Below that threshold, your heart compensates silently. Above it, you might feel tightness when climbing stairs. Tightness that goes away when you rest. We call this stable angina. It's your body's check engine light. But here's the important counterpoint. The majority of heart attacks occur in people with less than 50% blockage. Why? Because soft, unstable plaques, the ones that haven't hardened yet, are far more likely to rupture than large, calcified ones. The most dangerous plaque isn't the biggest, it's the most fragile. There is some genuinely good news here. Given time, your heart can build its own detours. If blood flow through a major artery is reduced gradually over years, the heart will begin growing smaller vessels to route around the obstruction. This is called collateral circulation, and it's one of the reasons a 70-year-old might survive a heart attack that kills a 40-year-old. The older heart had years to pave those side streets. In a younger person, a plaque rupture is sudden. The main highway shuts down without warning, and there are no alternate routes. One of the best ways to stimulate collateral vessel growth is through Zone 2 cardio and HIIT training. Exercise builds the backup network, and that network can quite literally buy you time. In emergency medicine, we say, time is muscle. After a heart attack begins, 20 minutes, irreversible damage starts 90 minutes. Heart tissue begins turning to scar tissue. Scar tissue doesn't pump, so recognizing symptoms matters. In men, the classic presentation is what you see in movies: chest pressure, left arm pain. But it's not always that obvious. In women, symptoms are often more subtle: extreme fatigue, shortness of breath, or intense indigestion-like discomfort. And for anyone, if you feel a sudden, unexplained sense of doom, that's a real clinical warning sign. Don't dismiss it. When blood flow is cut off and every minute matters, cardiologists perform a procedure called a PCI, percutaneous coronary intervention. A thin tube is threaded through the wrist artery. Dye is injected to locate the blockage. A small balloon is inflated to compress the plaque. Then a stent, a tiny metal mesh scaffold, is deployed to hold the artery open permanently. It's precise, it's fast, and it's most effective when you get there early.
The goal of everything we've discussed is simple. Find the fire before the house burns down. Standard blood work tells you what's floating in your bloodstream. It doesn't tell you whether it's sticking to your artery walls. For that, you need imaging. CEC score. Coronary artery calcium scan. A 5-minute, low-radiation scan that detects hardened plaque. A score of 0 is ideal. A score above 400 signals serious risk that needs active management. CT angiogram goes further. It can detect soft plaque, the unstable, not yet calcified deposits that a KAC scan misses entirely. This is your most powerful early warning system. The healthy heart attack is almost always a tragedy of ignorance, not of lifestyle failure. The plaque was silent. The symptoms were absent, and nobody thought to look. 3 things you can control starting now. Control your blood pressure. It's the mechanical force tearing at your artery walls every single day. Manage your blood sugar. Chronic elevation drives the inflammation that makes plaque unstable. Keep moving. Exercise builds the collateral network and reduces the long-term risk. And don't just assume you're fine because you feel fine. Use the tools we have. Get the data. Know your numbers. Your heart has been working without a break since before you were born. It deserves at least one good look.